Hello, good morning, good afternoon, good evening, wherever you are in the world. A very warm welcome to Meet Menaca, celebrating you. Today, we are going to be on our episode 69, talking about the hidden autistic spectrum amongst us with Dr. Anton Bala Canagasabey. Dr. Anton Bala Canagasabey is an award-winning consultant psychiatrist who specializes in working with adults with mental disorders. He has a particular interest in neurodevelopmental disorders such as autistic spectrum disorders, which is known as ASD, attention deficit hyperactivity disorder, which is ADHD, commonly known as intellectual or learning disabilities, and in neuropsychiatry. And on a personal level, I know Dr. Bala also is really interested in history, and I'm sure he will perhaps talk about himself a bit if we get time. Before I go to the speaker, let me introduce about the talk show a bit. Meet Menaca features real people sharing real stories, also healthcare professionals who come and educate us at various important topics which are commonly not talked about, and some commonly talked about, but which is really, really important. It is a vibrant talk show for 90 minutes, and it's a multicultural online talk show with the aim to celebrate you. So how you can join the event? It's a free event. You can register and join us. You can listen and learn from our Zoom calls, where you also get the privilege to put your questions directly to the speaker, or you can join our Facebook group or WhatsApp group to make sure that you also become the change maker joining the tribe. My request to you is a social platform to support us, to add value, to share inspirational messages and create positive change by subscribing to the YouTube channel. It's called Meet Menaca, and I'm sure the team will be sharing it, the link. You can support us spread these messages far and wide and create the impact we want to create. Coming back to the speaker, a very warm welcome to Dr. Bala. This is not the first time you are here on the show. This is the second time, and you have always supported us from week after week. You come and you support us, you ask difficult questions, you challenge us, you let us grow and give a lot of insights into what we can do further. So humbled and honored to have you as a guest speaker today. A very warm welcome to you, Dr. Bala.
Thank you, Menaca. Thank you for inviting me. It's a pleasure to come and present this topic. My hope is at the end of the topic, people will be more informed and would benefit from it.
Sure. Thank you. So what is autistic spectrum disorder? So the hidden autistic spectrum amongst us is 1 in 100 people are on the autistic spectrum. So we cannot be surprised if one of us are there, because some of us are diagnosed and some of us might not have diagnosed. I'm sure we'll delve deep and talk about it a bit more today. And also the chances are we all know someone who is autistic. And because we can't tell if someone is on the spectrum just by looking at them, some people might not have been diagnosed when you meet them. People with autism spectrum disorder experience social, communication, and behavioral challenges because their brains work in a different way from others. So to understand more about autism spectrum, I'm really keen to listen to Dr. Bala and see what he has to say.
Menaca, you talked about history, so let me tell a bit of history of autism.
Sure.
The first time it was mentioned was in 1908 by Dr. called Bloiler, and how the term came is in Greek, autos is self, so being alone, that kind of things were highlighted. After that, for quite some time, nothing happened. Then a psychiatrist in States, Dr. Kenner, he talked about among the children he's sort of seeing, there are a group of children that who are having these autistic features that Bloiler had mentioned. And so that is how it came to the surface. That was 1943. 1944, very independently, an Austrian pediatrician, he noticed a group of children who have similar limitations, as Dr. Kanna said. But this group of children, among them they had others, some of them, whose language is not impaired. I'll come to the three impairments in autism. One of them is verbal and non-verbal communication impairment. So language was not impaired in this group. And again, it went into the shelf. Then in 1980, that Asperger's, what he described, was translated to English. Once it got translated to English, it came to the forefront, both in UK and in States. So autism has three types of impairments. One is the social impairment or autistic aloneness. It comes from early childhood. Sometimes at infant stage itself, the parent, infant doesn't respond to the parents' affectionate behavior, especially the mothers, by smiling or cuddling, etc. They usually do not respond any more to parents than to strangers. They tend to behave towards people like they're behaving towards inanimate objects. These are some of the early signs. Sometimes these early signs may be missed out if that is their first child. If they have an early normal child, they can compare. So they may miss it out. Then in verbal communication, okay, language can be delayed. Again, it is acceptable to some extent. And both verbal and non-verbal. Sometimes it's within normal developmental process, the language to be delayed. Usually by a year or so, the baby will start saying one word, like mom or dad or some word. But getting delayed is okay for some time. But the same child may communicate non-verbally under normal circumstances. Here, no, non-verbal and verbal are impaired. And the third part of the impairment is obsessive desire for sameness, same routines, some food fads. They won't eat all the food, certain particular food only. And stereotypic, repetitive, ritualistic behavior with distress and anxiety if there is any attempt to change it. These are from the children's point of view, but let me tell a few examples. In adults, if we miss all that, and in adult stage, if you have to think of autism, this marked social impairment is poor eye contact, facial expression is less. Good example is Greta Thunberg. She has Asperger's syndrome. The climate activist, so if you look at her face, sometimes it's a very stern, mask-like face. And she talks, but very, the way she looks at Trump in certain forums is almost sort of hating me, I hate you. That type of a look can be said. So, adults, failure to develop peer relationships from school days onwards, trying to be alone, not even as a grown-up, they select jobs that they don't have much interaction with people, with maths, engineering, and let's say IT. And that doesn't mean anybody who is an IT expert is autistic. There are general people, very, very able. Here, these are exceptional. You can see in that sort of professions they go into. Lack of spontaneous seeking to share enjoyment, lack of social, emotional reciprocity in conversations and all. And more interested in talking than giving chance to talk. That doesn't mean anybody who don't give a chance to talk is autistic. It's a very broad field. All these, the loading should be there. talking about communication impairment in adults, delay, say, individuals, species, repetitive language, lack of varied, spontaneous, make-believe behaviors, and they are selected topics. I'm talking about adults here. In their selected topics, they may be able to talk, but they are not interested in the other. And ritualistic behaviors may be presenting like OCD, obsessive compulsive disorders. And I come across patients who smoke heavily, and they were asked to change over, and they had gone on to Nicorette. And in the outpatient clinic, he brought a diary of how many cigarettes he has smoked every day for the last so many 5 or 10 years. And now he had changed over to Nicorette. He has a record of that as well. But what is the use of all that? So non-productive, not useful, ritualistic behaviors. And so these impairments, again, I'll go social impairment, communication impairment, nonverbal and verbal, and the other one is ritualistic behaviors, wanting the sameness, food fads. These 3 impairments, at least one of them should have been there before 3 years of age. That is to diagnose autism. You would hear at different times autism, childhood autism, infantile autism, they're all the same.
Sure.
Now we have broadened it to autistic spectrum disorder. So these are milder variations, and always most of these conditions are in a spectrum. What is the height of a person? It is in a spectrum, like that. So that is before 3 years means childhood autism. Sometimes there can be a bit of a delay. Sometimes it may happen around 4 or 5 years. And so there is what is called pervasive developmental disorder, they are called, atypical autism. So in ICD-10, which is the WHO classification, and British input went in there a lot, British classification is International Classification of Diseases. Now it is 10th revision. In that, they talk about childhood autism and pervasive developmental disorder, atypical autism, high functioning autism. In the American diagnostic system, recently they revised it, DSM-5. DSM-4 has all 3 impairments, they say before 3 years of age. But in DSM-5, they have joined the communication impairment and the social impairment together. The argument is, well, it's very difficult to tease out when you're not communicating verbally or non-verbally. It merges into social impairment. So they have put them together, but DSM-4R, the one version that has all 3 impairments. I prefer that way of classification.
Sure.
So that is autism. Asperger's syndrome, let me touch on that. Same impairments are there in Asperger's syndrome as well. And that is, except the language impairment is not there, what Asperger noticed in 1944. So that name was given to that terminology, Asperger's syndrome.
Sure. Thank you, Dr. Bala. It's good to know about the autism, but I'm just going to touch upon what is autistic spectrum disorder, because I think there's a slight difference. We'll go into the difference later, but I think it's worth mentioning what is autistic spectrum.
Autistic spectrum disorder includes autistic disorder. In addition to autistic disorder, autism, Asperger's syndrome is in the spectrum. Pervasive developmental disorder is in that spectrum. Atypical autism is not having all 3 impairments. One of the 3 is not there. Asperger's is language impairment is not there. But it can be something, ritualistic behavior may not be there. So all that are included into the autistic spectrum disorder.
So do you think, Dr. Bala, it is much easier to spot these things if you're saying it's at the early age, and so there has to be awareness for the parents in particular about these things, because I think particularly in certain cultures, historically we haven't been very aware of it, and I think it's really important to talk about this more openly and more often, so that people are more aware of it, and particularly young parents.
Sure, that's true. Because if the awareness increases, they look out for it more, and they'll take the child to the doctors, to other therapies. And earlier the intervention start, the better it is for the neurodevelopmental phases.
Sure. Thank you so much, Dr. Bala. So what is you already touched upon is, so how does autistic spectrum disorder differ from childhood autism? Can people develop this, or is there a difference in it? And how, because I think this is a subject, because one of Stephen, who I know, he asked me to speak about this subject on the talk show. And also, I mean, he's not alone. I'm sure a lot of people are not diagnosed when they are kids, and it spills to their adulthood, and suddenly people realize I might be having this, or they are diagnosed later. So how does the autistic spectrum disorder differ from the childhood autism?
Yeah, childhood autism is another name for autism, because if it started before 3 years of age, and autistic spectrum disorder spans milder versions. For example, Asperger's syndrome is in the autistic spectrum disorder. Atypical autism, one of the impairments not being there, it is in the autistic spectrum disorder. And what else? High functioning autism. These are very intelligent people. Some of them are almost savants in their certain fields. There's no global impairment of intelligence, but very, very peculiar in certain ways. That is also in the autistic spectrum disorder.
I don't know how many people have watched that. There's a play called, and also a curious incident of the dog about Asperger's. I think it really gives you a very good insight on how people react to things. So how prevalent is autism? These days, of course, we hear the term autism, autistic spectrum disorder, Asperger's syndrome being mentioned a lot, but particularly by mental health professionals. And of course, also the general population more and more. Is autism or ASD prevalence is increasing? And if it is increasing, why?
Well, it's a yes and no answer for this, because early stages, say, I'm talking about in the 60s and 70s, they said autism, at the time, autistic spectrum disorder was not talked about much. So a lot of studies had happened in autism. Prevalences in the 60s and 70s, they were talking about 2 to 3 per 1,000 children or 1,000 population. Then more recent studies, they said 2 to 3%. That is for 100 population, 100 children. So it's almost a tenfold prevalence increase. Is it a recognition of the autism because of increased awareness? It's multifactorial. One of them is increased awareness, and the other is the way we do the studies has varied. Those days, it had been in one clinic. They did the study among a particular clinician's caseloads. Now it is multi-center, bigger studies, and also the psychometric instruments had come, the psychological questionnaires to screen and detect autism, and multidisciplinary we are now. So psychologists, educationists, everybody is looking for autism. And also the survival of the babies had increased. Those days when we were medical students in the 70s, below 28 years of gestation, pregnancy, we call it very difficult to survive. Now 28 weeks. Now 20 weeks is no problem. There are special baby care units, intensive care units, and survival rate is much higher. When the survival rate is higher, sometimes there can be subtle brain damage. So there can be these children who are made to survive healthy in all aspects. Here and there, they may have impairments in these areas, neurodevelopmentally. So it's multifactorial, the causes are, but the prevalence has increased now, yes.
Do you think it's, as you mentioned, I think, is it partly because of the awareness?
Awareness, yes. Increased awareness it increases the case detection, isn't it?
Sure, yeah. Of course. So going from there, if the prevalence has increased, do you think the prevalence of autism is similar or same in males and females, or is there a difference?
Yeah, in fact, it's more in males. It is roughly 4:1. Males to females, boys to girls. And Asperger's syndrome, it is 9:1. So it's even more in the male population. And if you look at the general population, the interests are also somewhat, I'd say, parallel. In the engineering field, in the maybe IT, is ladies are also there. Certain mechanical fields, males go for it more. They prefer to work sometimes solitarily. Working in a group or dealing with multidisciplinary teams, they feel it's not their cup of tea, or they struggle. Whereas females just go into like fish to water in group working. So even in general population, there's a slight tendency towards what sort of fields you select, what sort of interest you have. So autism is 4:1, Asperger's syndrome is roughly 9:1.
I think it's really important to know these things, Dr. Bala, don't you think so? Because if we don't, then I think it's because people walk into life without knowing about themselves, and the families and friends around them don't know how to approach them or how to interact with them. And I think it creates a big problem.
Sure.
So I think it's really important. So thank you so much for coming and talking about it today.
I'll tell you a couple of examples. I came across a professor, and I came across him after he retiring with depression. But throughout his life, he has had many of these impairments, but he was very successful in his field and went up to sharing a professorial post. His first marriage didn't work out. So they went to divorce, and during that time, he found another lady and he was sort of dating her. So the first time, the second partner and his ex-wife, or going to be divorcing wife, they met at the courts. Okay. After some time, both of them became good friends, because this professor doesn't like going on holidays. He's giving all the money she wants to go on holidays, but he doesn't like. He's not interested. His new partner also likes holidays. See, they got together and went on holidays at his expense, both of them.
I'm sure it's a sweet revenge.
Yeah. And but when he retired, he didn't know how to fill the space. He was lonely. There's no sort of recognition in his field, and he got depressed. And that is how I came across him. And we take a longitudinal history. Psychiatry, we take from childhood, antenatal period onwards, we take the history. So we come to know how his life had been.
It's a very interesting story, Dr. Bala. You must,
I'm sure you have people. Yeah,
you have a lot of stories to tell. So I'm going to be
yes.
asking more stories to tell later.
Get hold of a filmmaker so I can make a partnership and do films.
Yeah, okay, fine.
Yes,
If there are any filmmakers who are listening, here is the chance for you. The next question to you, Dr. Bala, is do we know the causes or the etiology in the medical terms of autism or ASD?
Well, broadly, we really don't know the exact mechanism. Here and there, we have snapshots. One is, it is more an organic disorder at the brain level. And in early stages, they thought it's more psychological. Refrigerated parents, they talked about more elderly.
What do you mean by refrigerated parents, Dr. Bala?
Basically, the parents themselves, they don't interact with the child. Mechanically, they deal with the child. They are mechanical between themselves. So in that environment where the child is growing up, whether the child is getting affected. Now we know it is an organic impairment, and then conditions like Fragile X syndrome, then some other Down syndrome, people with epilepsy, autism prevalence is higher. There is an underlying organic cause we know, and autism is higher. And about 10 to 20% of the people with autism has this kind of various genetic syndromes. And the other is brain damage. If there had been subtle brain damage in early childhood, or even afterwards, after a motorcycle accident of an adult, he may develop some autistic features. That doesn't mean he has autism, which was not there before. After brain damage, it is happening. So there is that sort of evidence. Then we go to the higher type of evidences like MRI scans. Now there are very sophisticated MRI scans. They are able to see the neuronal connections, we call it axons and neurons. Axons are, neurons are like a cell, battery cell, and the axons and dendrites are connection wires. So there is deficiency in those tracks had been found out. And also there are some neurotransmitter dysregulation. That is why we bring out our medication coming. Later I'll talk about the treatment. And lack of empathy. I'll show you a model. So can you see this is the brain
yes,
model. This is the front part of the brain. And this is the back part. This is the side. So frontal lobe, parietal lobe, and occipital lobe. Between the parietal lobe and occipital lobe, the connections in these people with autistic spectrum disorder, they have seen less compared to normal population. And also, this is the inside of the brain.
You have to raise it slightly, Dr. Bala. Now we can see, yeah.
Inside of the brain, I'm taking half of it out, inside of the brain. This area, there is a circuit which deals with empathy. We have found out that that circuit is also poor. So we know there is some underlying organicity, organic causes, but full picture we don't know. It is like a blind man going to look at an elephant. I don't know, some of you will know the story. 5 blind men went to look at the elephant. One got hold of the trunk and he said, elephant is like a trunk. The other one got hold of the ears and said, the elephant is like a big fan. The third one got hold of a leg and said, no, elephant is like a tree. So it is at that level. We know patches of information. Hopefully one day it all will be put together to see the elephant.
Yeah, that's a powerful story. It's all about perception, perspective from where you're looking at, I guess. Thank you so much, Dr. Bala. It was beautifully explained, and I think I'm sure like everybody understood a bit more about what causes autism. So if we know it is the prevalence, or it's increasing, awareness is also, of course, increasing, and we know what is causing it. So how do you manage it? What type of managements or strategies or treatments or therapies, different terminologies, it's like the elephant story, people use different terminologies, are available to help people with autism or ASD? Because I think it all boils down to that. And I'm sure you'll have more stories to tell about it with examples, but let's go into the management first, please. Thank you.
Management, in psychiatry, we look at biopsychosocial management. The biological management is the doctors deal with it more. Assessment, diagnosis, investigation, treatment with medication, biological management. Then psychological management. Psychological management is mostly done by the psychologist and other multidisciplinary team members. Some people develop an interest in counseling and various things. So behavior therapies are there. So that is psychological management. And the other one is biopsychosocial. Social support and strategies. So if I take from a childhood time, and let me go to the social first. Social is support for that, for those parents, for that mother, is very important. And education for that mother about not only autism, about how to bring up this child. Then it comes to educational level. Educational systems have to be more aware, they are guided. Sometimes you need one-to-one teaching because they can't be taught together. But so support and education is social management. Sometimes you need to have going to mother, working mother, how to deal with a child like this. And sometimes families split up, they can't cope. Some very rarely, they become more together to face that challenge. And that this child can take over their life. Everything is centered around this child. In fact, I know a particular family, the second child, first child was born normally, normal child, and second child had autism. The parents or the father spent so much of his time with this child, the other child got neglected. And the family life got really affected. So all those things, they have to be educated, the dangers of getting over-involved and trying to do the best for the autistic child at the expense of their life. So educational, then I'll go to psychological, I'll come to the biological last, because these are the things to be tried first. Sure. But psychologically, say, behavior therapy has to go in. There is what we call is positive behavior support, PBS. At different stages, they use different terms. It is basically observation, assessment that way, long-term assessment, say, a person, a therapist has to go and sit with the family and sometimes observe for the whole day, or few hours every day for weeks, very time consuming, resource consuming. Out of that, they formulate, this is the issues, these are the areas the parents are struggling, these are the specific difficulties, this particular, all the autistic children will behave the same way. Different aspects of autism becomes the challenge. So that sort of observation, more basic level ABC chart, that is antecedents, what is the behavior, what happened before that, and after the behavior, what happened. That sort of ABC chart is kept, and is behavioral psychological management. And if after all that, if that is not sufficient, then the doctors think of as a last resort for medication. There might be lots of aggression, then or agitation that has to be managed. So there are medication for that. And really, certain medication studies have shown are very effective. The SSRI antidepressants, which are used in obsessive compulsive disorders, ritualistic obsessive compulsive disorders, are useful in autism as well. Because one of the impairments is like OCD, ritualistic repetitive behavior. And studies have shown not only that ritualistic repetitive obsessional behavior decreases, even social impairment improves. Autistic children or autistic people avoid eye-to-eye contact. That doesn't mean everybody who avoid eye-to-eye contact is having autism, but the lack of eye contact is very well known. Even that improves. So studies are small studies, and mostly guidelines. Foods and Drug Administration Committee in US, they have nice guidelines. That is our UK National Institute of Clinical Excellence, that social care and clinical excellence. They have recommended risperidone is recognized as a useful antipsychotic medication with people who have agitation, aggression in autism. Then olanzapine had been used, another antipsychotic medication. SSRIs, antidepressants. If the anxiety is a big problem, say for example, parents with a child with autism, they are going to go for a party. The child can't cope, or they can't have a birthday party at home for the other child. At those times, what I do is I give an anti-anxiety medication. For the doctors who are in the forum, lorazepam is what I prefer, I use, and clonazepam is a liquid format, small dosage at the time when necessary, if required, like PRN, we call it PRN medication. That tides over that sort of situations. Sometimes needle phobia is very much more, and they won't give blood. So giving this medication to relax them, sometimes you are successful in getting the blood necessary for investigations. So medication comes that way. One or two antipsychotics are helpful. They are really, antipsychotic has become a common name. They are really psychotropic drugs. Psychotropic is facilitating the neuronal development and growth. And psychotropic drug is antipsychotic drugs, SSRI. SSRI is licensed for as an anxiety as well. So we give, for anxiety problem also, we give the SSRI. Then some of them benefit by, there's an anti-epileptic drug licensed for anxiety, pregabalin. But when you treat the epilepsy better, sometimes the autistic features decrease, showing the organic connection between these disorders. So these are the medication we usually use, and individually we have to assess which one will be helpful. In my clinical practice, if there is more OCD-like problems, ritualistic problem causing the challenge, I go for the SSRI. If there is aggression and agitation, I go for risperidone. And if it is anxiety problems are predominant, I use PRN medication at those places, or SSRI as an anti-anxiety medication. What else the medication will be useful? And with this armamentarium, you can help to some extent. I'll give you an example, a story. We always think of a child with autism. He was mild or moderate learning disability, but was admitted into residential home. Parents couldn't cope. Even in the residential home, he won't allow people to shave him, cut his hair. He will only eat certain types of food, and he won't interact with anybody. he was seated in a corner when he was referred to me. The behavior therapists had gone in, nurses had gone in, and they are unable to make things move. When I assessed him and found out this is autism, I was trying to, some time has to be spent in rapport building. Suddenly a doctor coming and telling him to take this medication. So you think about this is what is going to help this child or this person. But first try to develop the rapport with the carers and the parents. And then the next stage is slowly to suggest about this medication. And it takes 1 or 2 sessions to make them get convinced to give a trial. So there was a lot of resistance for medication, but I was successful in convincing them. And I prescribed an SSRI. They said, "Doctor, he's a new man. He's allowing us." This is with a few weeks of the medication. He allowed them to shave, cut his hair. He was interacting with some interaction was there. And later on, I adjusted the dosage and all. When he wants to go out, still verbal communication was poor, very minimal, but non-verbally he was communicating. If he wants to go out, he goes to the front door, taking the carer. And he was improved so much, parents took him home. And then I saw them at the outpatient clinic. Parents said, "Doctor, if he wants to go out, he takes my husband's umbrella and hat and gives it to him so they can go out." So they say, "With this, we are really overjoyed. Why didn't this happen before?" And this sort of rewards it is. Really, I'm happy when I see this. So I tell them, "Can you write this to me as a letter?" And I collate these letters to convince the other parents, because this is not proper study, but this sometimes has more weightage. Another parent, another case improving. I also warn them, everybody wants to be like that. Sometimes SSRI and antidepressants can overstimulate the person and they can become more aggressive. And sometimes antipsychotic medication, risperidone, may be too sedative or cause weight gain. So it is, their medicine becomes an art and a science. You have to find out and tease out and give incrementally, and it is very enjoyable, this field.
I thank you so much for that, because I think a couple of things, of course, it is social proof really stands out for other people to learn from. As a dentist, I cannot agree with you more that about rapport building first. Of course, we also see autistic children sometimes, particularly definitely in the preliminary period. And it is so important, usually for me, I don't do anything in my first appointment, just talk to them and then ask them to come back for the second visit to do anything else. But from that perspective, I also want to ask you, I know that I either reduce the intensity of the light or slightly change the direction of the light, because I know it is kind of a trigger and the noise is a trigger for them. As an expert, can you explain to us, I'm sure, why is that?
Yeah, it's part of, in autism, some proportion, a good proportion of the people, they are sensitivity to the sensory stimuli, not only light, varies. Some people, they can't tolerate certain sounds, higher pitched sounds. Otherwise, they themselves talk in a very high pitch. They don't realize that is uncomfortable to the people, that pitch. So sensory modalities, they're slightly varied. And pain sensation, sometimes they don't feel the pain. Otherwise, sometimes other people, they're oversensitive to pain. So it's either oversensitivity or hypersensitivity, undersensitivity is well recognized, but that is not one of the features of autism. The characteristic features means based on that we make the diagnosis. The associated features are we come to know over time. These are associated features.
Sure. It's interesting because I was listening to you and I just thought, because, I don't know why I do that. There's no evidence, that I have never been taught, but I think it was kind of learning on the job kind of thing over the years. I've learned this word.
Patients teach us a lot. Yeah.
Sure. Thank you so much, Dr. Bala. I'm sure we all agree. We have learned so much, but I am going to make an exception and ask one particular question from someone I know who asked to speak about this particular thing. He also, he said he probably won't be able to make the live interview, but I would love to hear his views on PDA, as it was first defined 40 years ago, yet still not recognized officially. All the people are working on this. And he went on to say a bit about him. My main problem at the moment is being 49, living with my 84-year-old father, who I'm now caring for 24/7 for the last couple of months. And I see where I get my PDA from. But he refuses to believe he's autistic in any way, and that makes it really difficult. Honestly, not sure how much longer I'm going to be able to cope. So, he then went on to talk about an incident which is recently happened in his household. But he finished with this sentence: they don't tell you this. This is how life is gonna be at school. So I think giving that importance for him, I thought if you can touch upon PDA and explain to the other people who don't know as well what it is and a bit about it, please, Dr. Bala.
Yeah, PDA is pragmatic demand avoidance or extreme demand avoidance. And the ICD-10 I talked about, the International Classification of Diseases, and DSM-5, they don't accept it as into the autistic spectrum disorder. But it is one of the impairments in the triad of impairments, if you see. The autistic loneness, the solitary behavior, ritualistic behavior, demanding for eat the same food all the time. You go and ask them to do varied food, you are putting a demand on them, and that child will avoid. So in adulthood also, they are very sort of restrictive and not prepared to change their ways. So demand avoidance. So if you detect demand avoidance in this manner, not full-blown autism, not detected in the early stages, then a full assessment to see from childhood onwards, you had to follow it up. Because he may be okay now, but before 3 years of age, he might have had more autistic features. And another thing about autism and autistic spectrum disorder is, as they grow, there's a tendency for mellowing with age. These impairments decrease. So when you cross-sectionally look at a person at, let's say, 25 years of age, all the impairments may not be there. But if you go back into the longitudinal history and talk to the parents, if the parents are not there anymore, the older siblings, they will give some information. No, he was like this in those days, and then it went away. So the diagnosis needs both cross-sectional assessment and longitudinal assessment. So if he goes for a full assessment, then he may be even atypical autism. And now I'm not saying it's difficult to diagnose like this. Diagnosis should be one-to-one, going details, sometimes into their private life. So that can be brought out. So if that particular person goes for a full assessment, there is a particular quotient that is called AQ10, Autistic Spectrum Quotient. It can be administered to us. It's a self-administration questionnaire. You can go into Google and put AQ10 or Autistic Spectrum Quotient. It'll get a sheet, A4 sheet it is something like this, 10 points. And in that, if you score about 6 or 7, it's good to go for the proper screening. Talking about screening, there is various psychometric instruments now. ADOS is Autism Diagnosis Observation Scale, ADOS. The other one is ADI, Autistic Diagnosis, but interpretative, I think, ADI. Interview, that's right, interview. What happens is, by sitting with a child or sitting with a person, coming to know the person more by observation, there are certain features you'll come to know. By talking to them and getting history, so the psychologists administer these questionnaires, or psychiatrists also use this. And but after some time, clinically, you almost smell it when you see a person with autism. Say I'm from Sri Lankan descent, Lankan. Sometimes you don't know what. You can say he's a Sinhalese, he's a Tamil, he's a Muslim. If you ask me, how do you say that? It's difficult. Something like that. He's an Indian Tamil, he's a Sri Lankan Tamil. You can say like that. Some people, when you see, I can say, is there any autistic problem situations there? And but by administering an instrument like ADOS, DISCO is another instrument, you can find out about 75% of the time. And these instruments, they have only about 75% concordance. That means one will be positive, the other one will be negative. So that is why they say autism is a clinical diagnosis. These instruments are the psychometric questionnaire instruments are like investigations. So a clinician, if they can diagnose it clinically, you go ahead. If you have any problems, you ask for these investigations as well. Then look at all of them together to formulate the diagnosis. So autism is a clinical diagnosis. It has to be really, the clinical diagnosis aspect has to be done by people who are really specialists in this field.
Thank you so much. It's very important. I think we spoke about it last week as well, to go to the right professionals and get that done in the right way. And I'm sure after listening to you, many of us are going to check out that AQ and see what it is there. Are we going to be in that spectrum as well?
You might be reassured that I'm not. I have 1 or 2 symptoms. Yeah. All of obsessive compulsive disorders, obsessional personalities, this is not in the textbook. Through my clinical experience, they all span in the same spectrum. Very, very mild obsessive compulsive disorder. Even below that is obsessional personality. But if I'm asked what personality would like to have, you have a bit of overload, I'll say I like to have obsessional personality. They are very conscientious in their work. They won't leave areas. They come to work in time and go in time. They have a conscience they have to satisfy. So these are good qualities. But overload of those qualities, you can make you a bit slower. You may check up the front door about 3 or 4 times before starting to drive. Switch a couple of times to make sure the back door is locked or not. So these are things you have to tolerate. Sure. Everything comes with, strengths and limitations.
Sure. Thank you so much, Dr. Bala. And I'm glad to know, my editor told me when I was writing the book, I think you have a bit of OCD, because I was going through it again and again. And I'm sure my friend Kiribay would agree, whenever we have to do a course or something like that, I go through that 100 times. She has to stop me saying, enough.
A lot of my friends I come across, quickly I can say he has some obsessional personality. He has a bit of OCD, but yeah.
Sure. Thank you so much. So we are coming to almost the end. What 2 to 5 things people have to and must take home and think about, so that they can share this with others as well, to increase the awareness of autism, Dr. Bala?
One is increasing their knowledge in this field, increase of the awareness. Then with your children, or maybe say having children of their own, it's good to share it. And the parents, if they are increased, they can be more aware, they can detect some of these things. And good to know that some of them mellow with age. And it's not doom and gloom. And so awareness increases to know that there are treatments and therapies available. Earlier you go for intervention, the better it is for the child and the family. And there are very able people in this group. If you channel them in the right direction, they blossom. Say, Greta Thunberg, in her book, she had said that she has Asperger's syndrome, and she was at home most of the time, no friends, alone all the time, and had eating disorder. But when she got into this, the parents were so happy. She blossomed, she grew. And with this emotional drive, she was able to overcome a lot of her impairments. Still, it is there to some extent. Say, she crossed the Atlantic to go for I think the previous GQ. She didn't want to go by plane because that is consuming too much of gas. But another person will say, well, whether you go or not, the plane is going to go. Why are you putting yourself in such a dangerous transatlantic going in a boat? She did maybe she couldn't look at it that way. On principle, I won't go by plane. So there will be some limitations, but I got patients who are interested in cars, but they don't want to go out. I ask them to be taken to car shows. So they will go out and talk about cars, read about cars. So through their interest, you can develop them, and there'll be big benefit to the society as well. Say, what interests me in autism was on a particular case that he had beaten up the community psychiatric nurse mercilessly because he came 10 minutes late. That is it was a big police case, court case, and mentally disordered offender. He was admitted to special psychiatric units, like where Yorkshire Ripper got admitted, Brampton. So I was there going as a psychiatrist. I was a senior registrar at that time, to assess him to see whether he can come back to the local hospital. During the interview, something caught my eyes. Say, when I talked about a date, he's telling the day as well. So I at the time it was file fax. I didn't have the smartphone. I was not there. In the late 80s. So I said, just out of interest, I said, last year I took a date and said, what is the date for that? He told them that was correct. Now it was a good game. I checked up about 4 or 5 times. Every time he was able to tell the day. And that islet of ability. Sometimes they have very high memory abilities in certain islets of certain areas are more developed in the brain. Then I say it is like the cornfield. You irrigate it not uniformly. In a patchy way, certain areas will develop more, other areas, the corn will die down.
Sure.
So is it happening there in the brain? And so islets of abilities can be made use of. The film Rain Man, that brother made use of him to break the gambling game, I think. Yes. This fellow was able to quickly tell what the answer was. It's a story, it's a film, but based on a real case, I think.
Sure. Thank you so much, Dr. Bala. And it's really important to understand and be aware that they can be very high functional. And in these days it can be managed very well. And I think it's important for people, for all the adults, to actively learn about these things so you can spot these things early and help the children who have to grow up, their families and friends, because it does affect the family life. Like you said, it makes a huge difference. Thank you so much. Immense gratitude, Dr. Bala. We all learned about autism a lot, and I think rightly so, it's time for us to start thinking about these things.
One more postulation. I'm seeing evolution now. I can see in my own way, am I seeing how the human brain is going to develop? A day may come in over centuries that many people will be able to have some of these higher abilities that autistic people are having. The potential is there in the brain. If you stimulate it, some of us may be able to go that way or see the future.
I know you have special interest in new brain, so we are going to be bringing back you as a speaker that's a topic on its own. So thank you so much, Dr. Bala. Following tradition, I'm going to announce what's going to happen next week. So next week, it is going to be promoting oral health, and I can't wait to do that. And it is about dentistry. It is a special session for me because 5 dentists who studied with me 30 years back, we qualified as dentists at the same time. We are all coming together at the same forum to speak about how we can promote oral health. They are from various parts of the world right now, but we all studied at the same place in Bangalore, India, a few years back, quite 3 decades back, just to be precise. So yes, next week it is oral health. Now it's time for Kirubei Kohut to give the vote of thanks, please.
Thank you. On behalf of Meet Menaca, celebrating you, for those who are on the Facebook Live, we would like to thank you. Keep following us on YouTube and keep following us live. And if you would like to join us on Zoom, the link is already placed on the chat. And we are happy to have you live on Zoom. And thank you for your participation. And for those who are our best participants on Zoom, we really like to thank you for your tirelessly coming every Sunday afternoon. You might be just wanting to take a nap, but you join us together to listen to interesting topics. We like to thank you for your participation. Last but not least, lovingly, we call Dr. Bala, who is Dr. Anton Canagasabey. We like to really thank you for your talk today and also for your support. Week in, out, you come and support Meet Menaca, celebrating you. And people like you, we really need on this platform. And as usual, I always come up with this acronym. Dr. Bala, B standing for a brilliant consultant. A stands for being authentic, always being real, ready to learn. L stands for being a leader in your own right, leading yourself by improving knowledge and leading others in your field. A stands for adaptability, listening to people, adapting yourself to the many different circumstances and situations for your patients and helping others. It is really a great honor for you to speak to us today, and we have become a little bit more knowledgeable on this difficult subject. Thank you, Dr. Bala. We thank you on behalf of Meet Menaca.
Thank you very much.
Thank you so much, Kirubei, and thank you, Dr. Bala, once again for that amazing session. We learned a lot. For people who are listening to us on Facebook, firstly, a massive thank you for all the support you give us week after week. It has come to that time of the day to say goodbye. Until we see you next week on Promoting Oral Health with 5 of my close friends from back in 3 decades back, friends, to talk about dentistry and how we can promoting oral health in general. Please stay safe, be happy, and keep smiling.